In this video today, we're going to talk about nasal cartilage chondrocytes. So those are the cells that are used for cartilage and make cartilage, and how they were taken to be able to be utilized for making the knee feel better and actually improve its function. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients understand what are their options for treatment, how to be able to get their lives back, and how to be able to punch pain in the face and get back to leading the life that you deserve. Today, we're going to talk about an interesting study that was done by researchers in Basel, Switzerland, that took chondrocyte cells from the septum of the nose and were able to culture expand those that have been able to place cartilage within the knee and have been able to follow them for 14 months with improvement in both pain and function. So as we know and have taught individuals who watch our channel, osteoarthritis is a little different than traditional rheumatoid arthritis because it's a wear and tear process, but it results in an inflammatory response within the various different joint that can cause a whole host of different problems. Cartilage transplants and injections and elements that try to promote cartilage have a problem, not only from the mechanical component, but also from that inflammatory response. The interesting thing about this particular study is that the chondrocytes from the nasal septum were much more robust and able to handle this inflammatory type response. One of the reasons for why cartilage cells seem to have a better effect, and what they saw in some studies, were that it was able to address one of the pathways that is a degradation pathway, which is the WNT pathway, which responded differently with nasal chondrocytes than what it did with other types of cells. The other difference from nasal cell usage is that it has a connection to other earlier precursor cells that in the body are referred to as neuroectoderm. And that gives these cells different properties than what might be acquired from traditional cartilage cells. Hence the reason for why it's a little bit more robust and how it interacts with that pathway differently. And what they were able to do were take nasal cells from the septum, be able to culture expand them and do some various different tissue engineering techniques to be able to then reimplant them in an autologous fashion, meaning the patient's receiving their own cells. And at that point in time, what they were able to see is differences over a period of time of a widening of that joint narrowing that previously existed, and they measured it via MRI. These results are encouraging because it allows patients to consider options other than traditional artificial joint replacement that may be more sustainable than some current measures being utilized. Again, this is being done in Switzerland, not in the States. And so they're able to do tissue culture cell expansion, which is a little bit different than some things that the FDA allows to currently be able to be done at this point in time. If you found this video helpful, give us a like. And if you found it not so helpful, tell us what we need to do better. We definitely want to be able to help our watchers and viewers get their life back and get back to leading the life that you deserve. Thank you so much for your time and have a great day.